So I want to welcome everybody as well, in addition to Linda's remarks. We're in a fight. We've been in a fight for decades. Linda made the fight visible 20 years ago. As a physician, we take an oath. The Hippocratic Oath says, I will prevent disease whenever I can, for prevention is preferable to cure. The problem is, as a doctor, your nose is, at least as a surgeon, your nose is in the operating room. Your nose is with that patient. As primary care physicians, you're too busy running around taking care of people. We don't know how to fight this fight. If we could get this law passed, that law would save more lives than all of us doctors put together. And that's where we need the lawyers. We need the lawyers to help us to put this together, to get this through Congress, to get this bill passed. It's not complicated. Ban asbestos in the United States will save tons of lives. And there are entities out there that don't really want to see a bill like that passed because they're liable. Some have been in the White House. So this is an important fight that, as a doctor, I can't fight this alone. We need the lawyers. We need you guys to help us. Now, that being said, there are a good number of people that have given their support who can't be here today. I've got 6 letters here, one from Senator Merkley, one from Congresswoman Bonamici, one from Congressman Don Bacon, who are all in support of this bill, who will fight to get this bill passed. And as you can see with the Epstein files, it's very hard to get anything passed. So you may think it's common sense and it's a no-brainer, but it is amazing how difficult it is to get anything passed. We also have a letter here from the president of the Collegium Ramazzini, which is basically the moral compass of planet Earth, in my opinion, that says that it's the right thing to do. We have the president, Edward Kelly, of the International Association of Firefighters, who's completely on board. And then the last letter is from Olin, which is a chloroalkali company that uses asbestos in their diaphragms when they're making their drugs. Even that company and their president are behind this bill because they know it's the right thing to do. So, like I said, I'm in the front lines. I don't know how to fight this fight. I can talk and I can state the obvious, but there are others who are better at fighting it. And I think there's no better physician at fighting something like this than Phil Landrigan. Phil Landrigan was here at Mount Sinai for several decades. He basically picked up where Irving Selikoff left off. And Phil, unfortunately, now has moved to Boston College. But during his time here, whenever I had a question, whenever I was trying to understand something, usually things that you couldn't find in a book, that you couldn't find on the internet, I would go to Phil and he would explain it perfectly. He understands what's going on here and he understands what needs to be done to get a bill like this passed. And so I want to introduce Phil Landrigan to come up and say a few words.
Thank you, Raja. Thank you, Linda, for having put this thing together. It's really good to be back here. I've spent 33 years in this institution. I have stood in the past at this podium, and it feels very familiar and at the same time rather strange to come back after 7.5 years and be in the same place. It's really good to be here. So this is the house that Irving Selikoff built, this medical school. The Mount Sinai Hospital was started in 1852 or 3. The medical school is a relatively new medical school as American medical schools go. It was founded in 67 or 68. Arthur Frank was a member of the first class. I arrived here in 1985. It was still a young institution in spirit. And it was very much the place that Irving Selikoff and his contemporary Kurt Duschel, chairman of community medicine, had built this place. And it was built on a spirit of reaching out to the community, to the local community of East Harlem, in which the north side of the hospital is geographically located, reaching out to the workers, reaching out to the unions. I remember one of the very first experiences I had after I got here with Dr. Selikoff that first summer, July of 1985, was going over to New Jersey to the Asbestos Workers Picnic, which was an annual event. And Dr. Selikoff was revered by the asbestos workers, and being introduced by him to the president, to the business agent, to the workers, hearing some of the stories, and basically becoming part of the Mount Sinai family, part of Selikoff's family. I had the privilege to overlap with him here for 7 years, from 85 when I arrived until 1992 when he passed. He was an amazing man. On his deathbed, he had a slow death from cancer. He wrote 4 scientific papers on his deathbed, which to me is just an extraordinary accomplishment. Selikoff always taught us, as Raja has said, that to prevent is better than to cure. And he built Mount Sinai on 2 pillars. First was research. Selikoff taught me, he taught every one of his students, fellows, and residents that any advances in the field of medicine, any advances in public health, had to be based on meticulous research, that you had to do it right, you had to take the time, you had to look at the x-rays, you had to interview the patients, you had to do the physical exam. I had the privilege to see some of Dr. Selikoff's notebooks. His notebooks were meticulous. The level of detail that he wrote down, and he actually had legible handwriting, which I think he may be the only doctor I know who does, were incredibly detailed notes. And all of his research was then based on extracting nuggets of information from those records and putting the pieces together. So research was the first pillar. And the second pillar, which he exemplified par excellence, and which all of us try to do to the best of our ability, is courage. Selikoff spoke truth to power. He had the facts. The facts were rock solid because his research was so good. And he took those facts and he went in the face of Johns Manville and Grace and the other asbestos companies and basically held them to account. And they did what threatened oligarchs do. We see it today in our world. They went after him. They went after his science. They did their best to discredit him. They would have doxed him if that term had existed at the time. It didn't. They would have trolled him on the internet if they could have, but there was not yet any internet. But they did what they could to knock him down and belittle him. He did not waver. Selikoff persevered. He built this place. He built a generation of doctors, which is now into its second and third generation, of people who are dedicated to working with unions, working with labor, working with groups like ADAO to do the right thing, to prevent disease, to make things happen. And it's just an absolute honor to be back here this morning and to be part of this. Thank you.